a 500 times greater effect than she said. So she turns out to be very conservative, not radical as she's been thought of for so many years. And then ICRP was even lower than Alice's estimate. So they're off by a considerable amount. And the difference is ICRP was using external radiation given at a very rapid dose, whereas what was really happening to people was low-dose, internal, chronic exposure to radiation. And you can't do that. I mean, you can't use one to guess what happens in the other situation. When you have taken the radioactive material into your body with food and water, and it lodges in tissue, you get a contact dose. You're not a distance from it like you are from the X-ray machine. And the X-ray machine is over in a few seconds, whereas when you carry it in your body, it's there for years. It could be there for years. So this is a different situation. And it turned out to be much more damaging than was admitted by the nuclear industry in the beginning. China is just beginning to wake up too. They have a nuclear atmospheric test site in Lapsor, and it's right on the border with Kazakhstan. And the Russian nuclear base was in Kazakhstan. So what happened was some of the people from Kazakhstan tried to escape their nuclear testing, and they moved over to Lapsor in China, and that's where the Chinese set their tests off. And I was at the University of Beijing in 1995, and I spoke at the medical college there. And they told me that they had never heard anybody say there were any problems with nuclear testing at that time. This is the medical school, public health department. Never heard of any problems with the nuclear test. So now they're having their lawsuits and demands from nuclear workers, nuclear veterans, the people who live near Lapsor, and so they're kind of waking up to the fact that they've had problems for a long time, and it's been hidden. Now the other thing that's happening, and many of us have been saying, it's kind of ridiculous to think you do this very general damage to cells and human cells and tissues, and the only problem is you might die of cancer. That's very limiting biological endpoint to look at. That was decided by the nuclear engineers who brought us the Manhattan Project, and they decided this in 1950 before they had even collected material on what happened in Hiroshima and Nagasaki. Another big myth is that our radiation protection standards were based on the studies in Hiroshima and Nagasaki. That's not true. Those studies were not even first published until 1957, and the standards were set in 1950. So it's, they didn't base it on anything. They just used the Hiroshima and Nagasaki studies to support what they had picked as their radiation protection numbers. So it's been really, I think, very much influenced by atmospheric nuclear testing, which, as you probably know, started in 1946, right after the war. So they started doing this atmospheric testing, and they were blanketing the whole of the northern hemisphere. And they didn't want a lawsuit from some country that fights the fallout. And U.S., Canada, and U.K. had 3 different radiation protection standards in 1945. So between 45 and 50, they decided 2 things: that they would only count death from cancer, not even cancer incidents, and secondly, that they would set their dose as a risk-benefit trade-off at 5 rem per year for workers and 0.5 rem per year for the general public. They never claimed it would be safe. They said it was a trade-off to allow the nuclear industry to grow. And so this was all done before they even had collected the long-term study material at Hiroshima and Nagasaki. So it's coming to roost now. So another thing that's happening is the biological endpoints are being expanded. And I think the first one that they're beginning to admit is the effect on the neurological system. They're finding a lot of neurological damage that is now being documented. I think, unfortunately, this is coming from the Ukraine. And it's probably the first breakthrough. It has a connection with the use of depleted uranium in the first Gulf War, because the outstanding effect among the veterans was neurological damage. I don't know what you know about the Gulf War, but they used uranium bullets for the first time. They used the waste, the depleted uranium waste from the enrichment process, and they fire it, and in firing it, there is a friction caused fire, and uranium burns at a much higher temperature than TNT. So they changed the nature of the battlefield, the nature of war. And the temperature is over 3,000 degrees centigrade, whereas TNT burns at about 575 degrees centigrade. So you have this escalation of heat, which vaporized and aerosolized the uranium. And aerosolized uranium, if you breathe it in, can go directly from the nasal passages to the brain. So you have brain damage here. And these very sensitive brain tissues are directly incorporating uranium. And it's an outrageous situation.